Hello, my name is Sheheryar Kabraji. I'm an associate professor of oncology at Roswell Park Comprehensive Cancer Center, and I'm also the director of translational breast medicine. So I went to medical school actually in two places. I was at the University of Cambridge in the UK, where I did my preclinical training, and then I did my clinical training at the University of Oxford, also in the UK. So there's two parts of medicine. There's the actual looking after people, and there's the actual looking after people in a better way each day, and that's the research part. And so it's the combination of being able to make an impact for the better in people's lives, but also be able to make that impact better each day through research that made me want to be a doctor. It's combining those two things. Oncology is often, which is what I'm a specialist in, is often thought to be a challenging field. It's a serious illness, but the outcomes are getting better every day. And I think that sort of mix of hope, advancement, and also looking after people was how I was drawn to oncology. So I think breast cancer really is, in as many ways, the gold standard for oncology care. It was one of the first specialties that found that less surgery was better than more. It was one of the first specialties to use a targeted therapy in the way of hormone therapies. One of the first specialties to actually use what was called neoadjuvant therapy, which is therapy before surgery. So in many ways, breast cancer care really leads and other sort of groups follow, and I wanted to be part of that community. There's many things in breast cancer that are exciting. One of these is the use of immunotherapy to hopefully cure patients, but also one of the big changes in our field is actually more personalization of therapy, being able to choose exactly how much treatment someone needs based on molecular testing or based on a better understanding of the person themselves. And I think that really is an advancement in a way that is often underappreciated, where we're actually giving less treatment, but actually getting as good outcomes, and therefore helping to spare toxicity. So I love being able to look after my patients. I love being able to work with my colleagues. A place like Roswell Park, where there's a sort of singular focus on the mission to look after our patients, but also to deliver the best care through our research, gets me excited in the morning. I have done all my postgraduate training in Boston, Massachusetts, where I was a resident at Mass General and then a clinical fellow at the Dana-Farber Cancer Institute and a junior faculty at the same place. Having gone through both clinical training, I made the decision relatively late actually to decide that I really wanted to have my own research program through a laboratory, and an opportunity at Roswell Park came up that was quite unique, which is to both set up my lab, but also to use that lab to actually better patient care through what's called translational research, taking lab-based discoveries and using them to drive or improve clinical care. And that was an opportunity I just could not pass up.